Well, in the study we did in the Inselspital Bern and the Department of Angiology, we included 691 patients with symptomatic peripheral arterial disease who were referred to our hospital for intervention of the peripheral vessels for either simple balloon angioplasty or even stenting. And in our daily protocol we included as well the information on the lipid levels as well as on their statin medication. And in the time course, most patients were then referred back to us, and we were able to see and put the data in our registry, which statins they had, which doses they had, and what were the LDL levels and what was the outcome of these patients. And we found that over the time course we were able to increase the statin adherence from about 73% to 81%, and parallel to that we were able to reduce the LDL cholesterol levels from about 97 to 83 milligram per deciliter, and we were able to increase the percentage of patients on high intensity statin therapy, meaning mainly rosuvastatin or atorvastatin. And this was then parallel as well with a change in mortality rate, and we were able to see that patients who were always on their statin therapy had a pretty low mortality rate of about 20%, but patients who had even an intensified therapy had a 10% mortality rate, and patients where we started a statin therapy still profited from it and had only a 15% mortality rate. But on the other hand, which was not surprisingly, patients who were never on statins or discontinued their medication with statins were about 35% mortality rate. But the most shocking to us was that when patients discontinued their usual doses and decreased it, they suffered an even higher mortality rate of nearly 43%. So that was kind of surprising and shocking to us. Now, what should one tell the patient to do? We know that patients with peripheral arterial disease are a little bit more underrepresented in the daily practice. First of all, it's hard to identify them when they're asymptomatic, but as soon as a patient is symptomatic, well, one should really at least keep the patient on the statin dosage they have, if they have a statin. If not, quickly introduce a statin dosage, but never discontinue with a statin or decrease the dosage. And tell them that they are at a very high risk to suffer a myocardial infarct or a stroke. Maybe the highest atherosclerotic population to be at such a risk.